तो हाय एवरीवन एंड वेलकम टू माय चैनल क्रिएटिव स्पेस। और आज हमारे साथ है डॉक्टर सौम्या, हेड ऑफ डिपार्टमेंट है ऑफ मेडिकल इमरजेंसी जहांगीर हॉस्पिटल। शी इज हियर टू शेयर विथ अस एक सीपीआर हम कैसे परफॉर्म कर सकते हैं। अगर आप डॉक्टर भी नहीं है पर आप बहुत सारे जाने बचा सकते हैं। इट इज द नीड ऑफ द आवर। बहुत सेंसिटिव टॉपिक है ये। और टू क्रिएट अवेयरनेस, टू कोलैबोरेट विथ मी वी हैव डॉक्टर सौम्या. So first of all, Dr. Soumya, thank you for doing this for Creative Space and welcome.
Thank you for inviting me, Neha. Yeah.
Yes. So please introduce yourself, a brief introduction.
Yeah, sure. So I'm Dr. Soumya Chandrasekhar. I'm heading the emergency department at Jahangir Hospital. I've been here for almost about 10 years, and we see multiple emergencies here, medical, surgical emergencies, almost about 12,000 ER visits. And as many of you in Pune may be familiar, we have a cardiac ambulance that caters to all sorts of emergencies. And we're one of the few ambulances that has a doctor accompanying the emergency medical services team to the location from where we retrieve our patients. So, yeah. So that's a little bit about what we do. Yeah.
Okay, that's nice to know. अब मेरा अगला सवाल ऐसे होगा कि सीपीआर का फुल फॉर्म क्या है और कितने लेवल्स ऑफ सीपीआर होते हैं?
ठीक है, तो सीपीआर का फुल फॉर्म एक्चुअली है कार्डियोपल्मोनरी रिससिटेशन। ये बहुत बड़ा वर्ड जैसे दिख सकता है आपको, लेकिन ये काफी सिंपल है। कार्डियो मतलब हार्ट, ठीक है, एंड पल्मोनरी मतलब लंग, हमारे जो फेफड़े हैं, एंड रिससिटेशन इज नथिंग बट रिवाइविंग द पेशेंट। ओके, तो सीपीआर वो पेशेंट्स में दिया जाता है जो एक्चुअली अनरिस्पॉन्सिव है, मतलब जिनका कुछ रिस्पॉन्स नहीं है, वो कार्डियक अरेस्ट में है, जिसका मतलब है कि उनका हार्ट भी बंद हो चुका है, उनके लंग्स भी पंप नहीं कर रहे। ओके, सो दिस पेशेंट इज बेसिकली अ पेशेंट विद नो पल्स and the person is not breathing and is not responsive also. So such a patient is the one who is in cardiac arrest and requires CPR. Okay, now coming to your second question, which is levels of CPR. Now that is something that has been classified by different societies. So levels of CPR just depends on the amount of exposure you have to CPR. That is, some lay rescuers who are not trained may be comfortable with just hands only CPR. That is, they may be comfortable only with छाती पे जो दबाव देते हैं, chest compressions देते हैं, उससे comfortable रह सकते हैं. They may not be comfortable with giving breaths, जैसे हम माउथ टू माउथ ब्रेथ्स देते हैं या फिर मास्क रख के जो ब्रेथ्स देते हैं. सो इट ऑल डिपेंड्स ऑन द लेवल ऑफ ट्रेनिंग ऑफ द रेस्क्यूअर. Okay, so suppose somebody has already attended or gone through a formal coaching or a formal training in basic life support, then they may be more, they may be able to go through all the steps of basic life support and give more advanced care to the patient. So it just depends on that. But yeah, it is not something that we need to worry about. But for a lay person जो जिनको पता नहीं है, अगर वो basic steps follow करेंगे, basic training, if they undergo basic training, they should be able to actually respond to an emergency and save someone.
Okay, fine. और हाउ टू नाउ आइडेंटिफाई, कैसे पता चलेगा कि आपके आजू बाजू में किसी को सीपीआर देने की जरूरत है, कैसे पता चलता है?
Yes. Yeah, that's a good question. Actually, जिनको हम CPR देते हैं, first of all, we have certain steps of CPR. Okay, we will show you with some demonstration. But some of the basic things that you need to know is that the person should be in a cardiac arrest for anyone to receive CPR. Now, what do we mean by cardiac arrest? Lay person को लग सकता है कि ये क्या होता है, cardiac arrest का क्या मतलब है, right? तो जब कोई आपके सामने, any near and dear one या कोई भी on the road, someone collapses. Okay, so if someone becomes unresponsive, how do you approach this scene? Okay, very first step that we say is to assess scene safety. Okay, so scene safety is basically, it should be safe for you as a rescuer as well as for the victim or the patient to receive CPR at that point. For example, if the person is lying on a road, obviously you need to move the person away from the road because there may be traffic there. Or if there's a fire, you need to be safe, and the victim also needs to be safe. So the very first step is scene safety. The second step would be check for response. Okay, so it's a very basic thing. All we do is we tap on the shoulder of the patient and say loudly, are you all right? या अब ठीक हो गया. Okay? By saying, are you all right? If the person does not respond to you, then the next thing we do is we check for the pulse. Okay? Checking for the pulse is something that can be done very easily. Okay? We check for a pulse which is there in our neck. All of us may be familiar with checking. ये जो पल्स रहता है ये हम सबको आता है चेक करना, बट यहाँ पे एक पल्स रहता है जिसको हम कैरोटिड पल्स बोलते हैं. ओके, बिकॉज ये पल्स एक्चुअली जो हार्ट पंप करता है, दिस इज वन ऑफ द first areas where the blood flows through, right? So it is a pulse that can be easily felt, and this is the pulse that you need to check for in a patient with cardiac arrest. Okay, so you can take 2 fingers. If anybody wants to try, they can just feel for this, जो हम एडम्स एप्पल बोलते हैं मेन में, या जो ट्रेकिया या विंड पाइप है, वहां से आप 2 फिंगर्स राइट या लेफ्ट पे लेके जाओ इनटू दिस ग्रूव. ओके, अगर आप थोड़ा भी यहाँ पे लेके जाओगे तो इन दिस ग्रूव यू विल बी एबल टू feel the carotid pulse. So you need to feel for this pulse as well as look for breathing. Okay, breathing तो आप देख पाओगे कि पेशेंट का चेस्ट ऊपर नीचे जा रहा है क्या, वो ब्रीथ कर रहे हैं कि नहीं, राइट? सो साइमल्टेनियसली आप पल्स भी चेक कर रहे हो, ब्रीदिंग भी चेक कर रहे हो. अगर ये दोनों चीजें नहीं है तो CPR दिया जाता है. Okay, and in the meantime, before you check for this pulse as well as breathing, you need to call for help. Okay, that is a very, very important step. If you have a mobile phone with you, you should always take it, or if you are in a hospital setting, it will be easy for you to call for help. Otherwise, use your mobile phone and call any emergency medical services. Okay, so that they come in and they are there to help you, because how long will you give CPR? Okay, so these are the basic steps.
Okay.
So
okay, and अभी following this question ऐसे होगा कि how soon the chest compression can be given to the victim or the patient? अभी कितने जल्दी देना होता है?
Yeah, so this has to be done as soon as you detect that ये patient cardiac arrest में है. Okay, no time should be wasted. Why this is very important is ये जो patient है जो cardiac arrest में है, उनका heart अभी pump नहीं कर रहा है, right? So everything is in your hands, the person who is trying to rescue the patient. So when it has stopped, हम क्या कर रहे हैं, छाती पे दबाव देके उसको पंप करवा रहे हैं mechanically, right? Correct. So every time you are giving a compression, the blood is flowing to all the organs, and some of the very important organs are the brain, the heart, the lung, the kidneys, right? The brain, even अगर 3 मिनट तक भी blood supply नहीं रहा, जो ऑक्सीजन पहुंचता है ब्लड के थ्रू ब्रेन को, अगर 3 मिनट भी ये ऑक्सीजन नहीं पहुंचा, देन दैट पर्सन कैन बिकम अनकॉन्शियस, या जो हम बोलते हैं कोमा में चले गए, या फिर ब्रेन डेथ बोलते हैं, राइट? बिकॉज देयर इज नो ऑक्सीजन टू द ब्रेन. So it is very important that this is started as soon as possible. So that's why it is very important for everyone to know at least the basic steps of CPR.
Right, correct. And अब मेरा next question ऐसा है कि why are heart attacks commonly heard these days? I mean, what is causing it? क्यों हो रहा है?
Yeah, so heart attacks are basically what we call in medical terms myocardial infarction. Now, it can be one of the causes for what we call as cardiac arrest. So many times we confuse cardiac arrest with heart attack. Okay, because we are already on that topic, so I'm just telling you a bit about it. सो कार्डियक अरेस्ट अलग अलग चीजों की वजह से हो सकती है, जैसे ड्राउनिंग की वजह से, या चोकिंग की वजह से, स्ट्रोक की वजह से. हार्ट अटैक इज वन ऑफ द कॉजेज फॉर कार्डियक अरेस्ट. सो हार्ट अटैक में क्या होता है, हार्ट को जो ब्लड सप्लाई होता है, हार्ट को खुद ब्लड सप्लाई की जरूरत है, ठीक है? तो इन वन ऑफ दोज आर्टरीज इफ देयर इज अ ब्लॉकेज. Now, this kind of blockage can be because of multiple reasons. As we commonly know, अभी काफी awareness है इस चीज के बारे में. We all know that our lifestyle, okay, a lot of people are under a lot of stress, smoking, use of any form of tobacco, okay, lack of exercise, even a sedentary lifestyle. So now a sedentary lifestyle is almost like smoking, okay, because they say that sitting is the new smoking. So a sedentary lifestyle, no exercise, or other comorbid conditions like diabetes, high blood pressure, which is not under control, or medications are not being taken for that. So all of these factors can cause a heart attack. High cholesterol levels also, eating fried fatty foods and all of that. So our lifestyle definitely has a role to play in this. But also now I think maybe we are hearing more about heart attacks because there is also more awareness about it. Maybe in the previous generations, a lot of people didn't know कि क्या हुआ है. Somebody collapsed, something happened, they didn't know what the cause was. But now there is more access to healthcare. अगर आप हॉस्पिटल जा रहे हो या फिर कोई इमरजेंसी सर्विसेज आए तो वो ईसीजी करके उनको बताते हैं कि इनको हार्ट अटैक आया है. At least there's more access to healthcare, so that could also be one of the reasons why we find that it is more common now. Yeah.
ओके 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 और अब मेरा फॉलोइंग ये क्वेश्चन होगा कि सीपीआर देना कैसा है? व्हाट इज द करेक्ट मेथड टू गिव सीपीआर?
Yeah. So for that, I can actually show you how to do it. Yeah. Then, and also I want to tell you that this is something that we are showing you, but anyone who wants to give CPR, it would be better if they actually undergo formal training in
Yes.
basic life support, because only when we actually do it on a mannequin do we understand and we gain confidence about giving CPR actually when we face such a situation. Because even
Yeah.
all of us, we undergo many days of training for us to understand. And I think it is mandatory in a lot of countries. It's mandatory that everybody, matlab everyone, all citizens are supposed to undergo training, so that jo bhi ho pass mein, we are able to do something to save our near and dear ones. So the very first step in CPR is we are checking for scene safety. The next thing I'm going to do is check for response. Now how we do that is, aap theek ho kya? Are you all right? Okay, so this is what we do by tapping on the shoulders. अगर response नहीं है, patient कुछ भी बोल नहीं रहा है, then our next step is take your mobile phone and call for help. Okay, ask somebody to come to your location with this machine which we call an AED. You can say, please get an AED or a defibrillator. So call someone and tell them, this is my location, someone has collapsed, please get an AED. Okay, which is an automated external defibrillator. Okay, so once you have called for help, your next step will be checking for the carotid pulse. So like I already showed you, you're going to check on the patient. You can go down to the level of the person and check whether the chest is rising up and down to check for breathing. Now this should be done within 10 seconds. Okay, so you're checking for pulse and breathing within 10 seconds. If you can't keep track of time, you can count loudly before you confirm that there is no pulse and no breathing. Okay, suppose there is pulse and there is breathing, that can also be a scenario where there is a pulse and the patient is also breathing. In that case, just take the person to a safe area and wait until help arrives. If the person has a pulse but is not breathing properly, you can assist with breathing. Okay, you can give mouth to mouth respiration, or you can use a pocket mask to give respiration. I will show you how to do that as well. Okay, so coming to our scenario where there is no pulse, no breathing. In that case, we start with chest compressions, which is also जो हम छाती पे जो दबाव बोलते हैं, तो उसके लिए we have to use our dominant hand. If I'm a right-hander, my right hand will be placed on the patient's chest. So one way to do it is you basically interlock your fingers, okay, like this, and place the heel of your hand and in the center of the chest. In the center of the chest, जो हम breast bone बोलते हैं या sternum बोलते हैं, center में रखना है, in the lower half of the sternum at the level of the nipples. Okay, so I'll show you how we give CPR. Once I've interlocked my fingers, I place my hand in the center of the chest and make sure that my wrist, elbow, as well as my shoulder is in one straight line. Okay, and then I have to count loudly and give 30 compressions. That is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So I give 30 compressions followed by 2 breaths. Now you can give breaths by mouth to mouth respiration. If you're giving mouth to mouth, you need to pinch the nose of the person, encircle your mouth around the mouth of the person, and exhale into the mouth. At the same time, you watch for the chest rise. Okay, so you give 2 such breaths. If you have a mask like this is called an ambu bag. Sometimes you may be able to get a pocket mask like this. This sort of a mask is available online also. So if you have a mask like this, you can use that, keep it on the patient's mouth and give a breath through that also. In a hospital setting, we have this sort of a thing. So what we do is we give 2 breaths. So whenever you give a breath, you should always watch for chest rise. Okay, because that is an effective breath. Now this cycle I have to repeat 5 times within a span of 2 minutes. Okay, so I have to give 30 compressions followed by 2 breaths. Another 30 compressions, 2 breaths. Another 32, 32 and 32. This should be completed within 2 minutes. So it can get quite tiring actually, but with practice and if you know how to do it, it becomes easy. So the rate and the depth at which we give compressions is also very important. That is, it is said that we have to give 100 to 120 compressions in 1 minute. Okay, so that is the correct rate. And also the depth of the compression that you're giving should be 5 centimeters at least. Okay, so that's how we know that it is effective. Because तभी आपका जो heart है, आप pump करवा रहे हो blood को to all the vital organs of the body.
Can you repeat the compressions?
Yeah, so 100 to 120 compressions in 1 minute, which means अगर हम देखें 1 सेकंड में हम 2 compression दे रहे हैं, ठीक है, तो हर 1 सेकंड में आप 2 बार ऐसे कंप्रेस कर रहे हो. So 100 to 120 in a minute and depth of 5 centimeters or 2 inches. So this you have to keep continuing until help arrives. कभी अगर आपने अच्छा CPR दिया, so at the end of 2 minutes or at the end of 5-10 minutes, you may actually revive the person and they may start having a pulse. Right? Suppose आपको pulse नहीं मिलता है, आप यही continue करते रहो जब तक आपके पास help नहीं आ जाए. If you are in a public place where there is this machine called an AED, you may have this in public places like railway stations, airports, malls. Okay, so this is called an AED. So if someone brings that along, then it needs to be attached. You have to continue giving CPR. That will be attached and then the machine will analyze whether the patient needs a shock to be delivered. अगर आपको breaths भी देना नहीं आ रहा है, even if you can give only chest compressions continuously, even that can help patient. Because now with other infectious diseases, we are a little worried about giving mouth-to-mouth respiration. Right?
Okay. So my following this question would be, you explained that after 3 minutes, the brain can go in a coma state or brain dead situation. So we continue, anybody can continue doing that, but if the help arrives little later, if the person goes brain dead, at such situation also he or she can be retrieved, revived.
Yeah. So what I meant is that basically why we should know this is as soon as we should start CPR as soon as possible so that this situation does not arrive where there is brain death. But अगर ये हो जाए तब भी अगर आपने CPR दिया, heart and lung gets revived still. Okay, but it's just that there may be some amount of brain damage because there was no oxygen that reached the brain during that time. So that is the importance of starting early CPR. I'm not saying this happens all the time, but even 3 to 4 minutes can deprive the brain of oxygenated blood. So that's why it's important to start CPR.
Got it. So Dr. Soumya, thank you so much for showing us practically. So now my next question would be, what not to do in CPR? कहाँ लोग गलत जाते हैं?
Yes. So there's a common misconception between कौन से patient को actually CPR देना चाहिए, right? So knowing these 3 criteria, that is what we just checked, that is patient is not responding, that is one criteria. Second is there is no pulse and third is there is no breathing. ये 3 चीजें होना जरूरी है CPR देने के लिए. हम एक conscious patient को CPR नहीं दे सकते, right? Because many times someone is complaining of chest pain. Okay, it could be that they have they are suffering from a heart attack or they have some other complaint, but many times they are given CPR. So a conscious patient who is talking to you, who is breathing, is not one who needs to be given CPR. Right? So that's one thing. Apart from that, when CPR, when you already, recognize that this is a patient of a cardiac arrest and you're giving chest compressions, you make sure that there are no interruptions. Okay, give chest compressions for as long as possible continuously, because जितना आप chest compressions दे रहे हो correct rate पे, उतना blood supply maintain रहता है to all the vital organs. Even a few seconds of hands off the chest, like we already saw, can cause brain damage. Right? So commonly what happens is when we are giving CPR, there may be a crowd, there may be few people who want to come, see, do something else, but the person who's giving CPR should remain focused and minimize the time which is, the hands off the chest time, so that we don't have too many interruptions. And one more thing is, whenever we're giving chest compressions, make sure that the chest recoils also. The CPR should not be so fast that the chest is not recoiling in between the chest compression. Why this is important is when you have pumped it, right, and the blood is flowing, you are allowing for recoil so that the blood that you have pumped also has time to return to the heart, right? So chest recoil is also important. And the third thing is, when you're giving these breaths, whether it is mouth to mouth or using a mask, when you give the breath, make sure that the chest is rising when you're giving the breath, because only then it's an effective breath. So these are some things that we can remember. Yeah.
Okay, very good points. Thank you for that. So my next question, Dr. Soumya, would be when to stop giving CPR to a person?
Yeah. So now this is a difficult question to answer. For example, you see someone who is unresponsive, probably on a road, or someone who you have not witnessed, like you've not witnessed that person becoming unresponsive. Now that is a difficult question to answer because you don't know when the person became unresponsive. So in those cases, if you feel that there are any signs of life before, when the pulse goes, sometimes you may notice that someone is having something called an agonal gasp. That is, the pulse has gone, but although the person is not breathing properly, it may be the last few breaths, which is something like, okay, and they are just, it's not a proper breath, but it just is because those respiratory muscles still have some, movement that happens. Where actually the person is not breathing properly, but ऐसे gasp जैसा होके रुकता है. So that's when you know that अभी हुआ है, शायद उनका cardiac arrest अभी हुआ है. तो in those kind of cases, you know that it will be of a lot of use if you start with CPR, because that person has probably just collapsed. Okay, but you don't know about it. But agar you know that this person, sometimes you can see that someone's body has already become very stiff and all that, you know that काफी time pass हो चुका है, उनमें CPR देके ज़्यादा फायदा नहीं है. But if anyone is telling you that this person has just collapsed, या फिर you know that, or someone is calling for help, it's better if you try this at least for a period of about 45 minutes before we say that we cannot do anything further. At least we should give the person a chance of continuing with CPR for 45 minutes, because there have been many case reports where patients have been revived. In our own experience, we've revived patients almost about half an hour after they've come into the hospital. So we should never give up hope. But then again, it is a difficult question to answer, because how long do you continue in case no help arrives? How long do you go on? So if you have that sort of a dilemma, at least try for about 45 minutes.
Okay. Thank you for that. And doctor, for a layman, जो भी जाते हैं रास्ते में, या somebody like us also as common people, क्या first aid kit अपने साथ होनी चाहिए, which will help us or others, and we can help people revive through CPR. क्या होना चाहिए? What will you say on this?
With respect to CPR, one thing that everyone can carry is the pocket mask, which I mentioned. Okay, that is something you can order online also if you're interested, and keep it with you, because in case we don't know when there will be an emergency. So if you have a pocket mask, that will be easy for you to give these kind of breaths if you're not comfortable with mouth to mouth.
So, Dr. Soumya, my last question would be anything else that I must have missed asking, और जो बहुत important लोगों को जानने के लिए, what would you like to share?
Yeah. So apart from this basic CPR that we've learned about, we should also know about this device, which is commonly available in a lot of public places, like your railway stations, shopping malls, and in airports also. Now, this machine is called an AED, which is an automated external defibrillator. Okay, commonly हमने सुना होगा कि वो patient को shock दिया था, right? When someone is in a cardiac arrest, there are different types of heart rhythms. Okay, we have said that the heart has stopped, but sometimes there may be some irregular rhythms, okay, which is not resulting in a pulse, but it is an irregular rhythm that requires a shock. Now, so there are two types of rhythms, that is shockable rhythms and non-shockable rhythms. Okay, so कुछ rhythms में ही shock दिया जाता है. Okay, तो इसीलिए हम पहले ही जब हमने देखा कि पेशेंट अनरिस्पॉन्सिव है, वी हैव कॉल्ड फॉर हेल्प एंड आस्क्ड देम टू गेट एन एईडी. ओके, जब आप सीपीआर दे रहे हो, अगर कोई ये डिवाइस लेके आए आपके पास, तो बेसिकली यू शुड नो हाउ टू यूज दिस डिवाइस. ओके, दिस इज जस्ट अ ब्रीफ अबाउट इट. Of course, you should receive training on how to use this, but just in case this is available, you should know the basic steps. Okay, so ये AED machine जो है, you will see something like this. Certain steps to using this device. Okay, we can commonly remember it with a mnemonic, that is PASS. Okay, PASS करके mnemonic है, जिससे हम ये याद रख सकते हैं कि कैसे यूज करना है. That is PAAS. Okay, so P का मतलब है power on. Okay, so just like any other device, there is a power on here. Okay, so you just have to press that. Okay, so once you switch it on, वो power on हो गया. Then you have these chest leads. Okay, जो sticker जैसे रहता है. Okay, इसको peel off करना है. And यहाँ पे आपको दिखेगा कि ये जो एक चेस्ट लीड है, इसको निकाल के पेशेंट के चेस्ट पे लगाना है. यहाँ पे दिख रहा है कि कहाँ पे लगाना है एग्जैक्टली. इट इज जस्ट बिलो द राइट कॉलर बोन. ओके, सो एक आता है आपके राइट कॉलर बोन के नीचे, एंड दूसरा स्टिकर जो है इसको निकाल के यहाँ पे प्लेस करना है. दैट इज जस्ट स्लाइटली टू द लेफ्ट ऑफ द लेफ्ट निपल. Okay, so that is also shown in the diagram, so you can just use that and stick it. So once you are done sticking this to the patient's chest, दूसरा जो भाग है, this wire, you also have to attach it to this machine. Okay, so power on हो गया, आपने attach किया ये pads to the patient as well as to the machine. Okay, third step is this machine will automatically analyze the heart rhythm. Okay, so ये जो machine है बोलेगा analyzing heart rhythm. Okay, so when it says analyzing heart rhythm, तब आपको CPR stop करना है, मतलब आपको हाथ उठाना है patient से, because ये machine analyze कर रहा है, तो उसको analyze करने देना है. Okay, so it will analyze the rhythm and then it will say shock advised or shock not advised. Okay, so ये machine खुद बोलेगा. So अगर वो बोलता है shock advised, then यहाँ पे जो एक है, this will start blinking. अगर वो blink होता है and ये machine बोलता है shock advised, then all you have to do is press this shock button. Okay, when you're pressing, just make sure that no one is touching the patient, because there will be a shock like sensation to the person's body. So you're just pressing that. Okay, if it says shock not advised, आपको कुछ करना नहीं है, आप सिर्फ सीपीआर फिर से चालू करो. ठीक है, अगर एक बार आपने ये मशीन अटैच कर दिया है, ये मशीन हर 2 मिनट खुद एनालाइज करेगा. ओके, एट द एंड ऑफ एवरी 2 minutes it will automatically tell you analyzing rhythm. When it says analyzing rhythm, again you remove your hands off the chest, you allow it to analyze, and it will say shock advised or not advised. Advised बोलता है तो you move away from the patient and press shock. Not advised, don't do anything, continue CPR. Okay, so that's about it. So this is a very easy device. You just have to follow the commands that it gives and remember it with this mnemonic. Power on, attach the pads, analyzing rhythm, and S is shock. So PASS is the mnemonic. Yeah.
Okay, following this question would be, जब वो shock देता है machine to the patient and we all are side में चले जाते हैं लोग, we don't, nobody should touch the patient. उसके बाद automatically does the machine stop giving the shock treatment after few seconds?
Yeah, so what it does is it charges itself and it delivers a shock within a few seconds, within 1 to 2 seconds. Okay, and it will automatically say shock delivered. Okay, so it says shock delivered, and that happens within a span of a few seconds, within 2-3 seconds. Okay, and then you can resume giving chest compression.
All right. A lovely piece of information and awesome device. Thank you so much, Dr.
Yeah,
Soumya, for that.
you're welcome. Yeah,
So, Dr. Soumya, thank you so much for sharing
you're
this
welcome.
wonderful piece of information. Thank you to Jahangir Hospital for shedding some light on the most required, I think, information and awareness that people need to know. हर एक इंसान को इस information के बारे में बहुत जानना जरूरी है. So many people have lost their loved ones. थोड़ा भी अगर इसके बारे में अवेयरनेस होती है एंड यस टू ऑल द व्यूअर्स, जैसे डॉक्टर ने सजेस्ट किया है, प्लीज अगर आप इसके बारे में ट्रेनिंग ले सकते हैं या जहाँ पे ये वर्कशॉप्स कंडक्ट होते हैं, खुद जाइए. इट्स वन टाइम थिंग जो आप किसी का भला कर सकते हैं. तो अगर आप इसके बारे में ट्रेनिंग लेते हैं, डेफिनेटली गो गिव दिस गिफ्ट टू योर सेल्फ एंड हेल्प अदर्स. So Dr. Soumya, thank you so much once again for coming on my channel and collaborating with me. And thank you once again.
Thank you, Neha, and thank you for spreading this awareness amongst everybody. I just hope this will be, an initial step for people to take action and to learn these basic life skills. Because somewhere you may be able to help someone, in need.
Yes, yes,
So
yes,
yeah,
yes. Yes,
yeah.
thank you, thank you, thank you
Thank you.
once again, guys. Like, share, subscribe to my channel. Please see all the other informative videos and share to everybody you know. Thank you.
Yeah. Thank you, Neha. Thanks.